historians, full-blood Muskogee Creek citizen, fluent speaker of our language, was one of the first ones to die from COVID. It was terrible. One of the main reasons we bought this building is so we could enhance our intensive care unit, so we could enhance the level of service we're providing to our Muskogee citizens. The building you see today is a little over 300,000 square foot facility. To be exact, when we do a tour, I'm not going to make you walk all 300,000 square foot, but it's a 20-acre campus, 336,000 square feet. There's also 153 hotel rooms, and I'll explain those here in just a second. So this building was formerly owned and operated by the Cancer Treatment Centers of America, so it was an oncology hospital. Actually, Mr. Will Jones, again, Creek citizen, he actually worked here several years ago as the director of radiation therapy. So getting him back here as a part of our leadership team, he knows more about the building than probably any of us who's been here. So we're glad to have him. But this hospital, it is unique because it has those hotel rooms. Again, the hotel rooms were intended for people that were coming out of state, again, to stay in those hotel rooms to be close to their family. So when this building presented itself to us, especially right in the midst of COVID, our wheels started turning. Again, during the middle of COVID, a lot of death and dying. As tribal people, the death and the grieving process is big, and again, in our Muskogee culture, I know for a lot of our tribal citizens it is. Dying alone is something that, again, I've never seen in our culture, right? I remember as a youth growing up, going to a funeral. For one, I never hardly seen my family unless it was at a birthday or a funeral, right? That's where everybody's seen each other. But we were always together. It was a process. During the middle of COVID, people were dying alone. One thing that drew our attention to this building is, one, the hotel rooms, and secondly, this campus, we're going to be remodeling rooms up on our hotel room to have a hospice. Several of our administrators visited Cherokee, North Carolina, to look at a state-of-the-art tribal hospice program where the rooms are about probably half of this size, where if we ever have another pandemic, that when you go through that grieving process, our citizens and our families will be able to be with those loved ones as they go through that process. Not everybody wants to obviously pass away in a hospital, but sometimes that has to be a choice, right? You can't take care of your citizens at home, and you have to have those needs. So we are excited about that. But again, this is a 20-acre campus, over 300,000 square foot. This is going to be a specialty campus for us. It has 33 med-surg beds and 7 ICU. So this is our highest level of care. This is our third hospital here in the Muskogee Creek Nation Reservation. We have the Creek Nation Community Hospital, which is a critical access hospital in Okemah, Oklahoma. It's a lovely $46 million facility, beautiful campus. We have the Omauge Hospital. That's one of our largest campuses as well. It's a 66-bed acute care hospital that has an emergency room. And then this is our new specialty hospital. Here currently on campus, as you go through here, what you'll see is we do have a 7-day-a-week urgent care open. One thing that we believe here at the Muskogee Creek Nation is delivering health care at the right time, the right place, at the right price. What I mean by that is most of the time our emergency departments are flooded, they're oversaturated, and most of the time, as all ERs are in our areas, most of the time patients who sometimes go there don't have another avenue, but usually their visit is not an ER-specific visit. We've opened up this urgent care here to help offload some of that volume of our emergency department. So we operate a 7-day-a-week urgent care here. It's open Monday through Friday, 7 to 7, and 9 to 5 on the weekends. We have a board-certified addiction medicine physician here that specializes in HIV Hep C treatment. I think we've got some partners from the Chickasaw Nation coming up next week to talk about their addiction medicine program and their HIV Hep C program. We also have neurology at this hospital. We have a neurology outpatient clinic. We have a full comprehensive primary care. We have a board-certified and residency-trained urogynecologist who does surgical robotics. The Muskogee Creek Nation Department of Health, we are the first tribe in the lower 48 states to have a Da Vinci robot. So we will be doing robotic surgery at this location as well. We have a Da Vinci 8XI machine, which is the latest and greatest robotic surgery, where we'll be able to do special procedures such as orthopedic, urogynecology. Again, in the day and age of surgery, robotics is very big on the scene right now. Quicker recovery times, smaller incisions. It's a great tool for our surgeons to have. So we're very proud for Indian country to be a part of that and have the first robot here in our reservation. So we're super excited about that. Again, the Muskogee Creek Nation is really invested in, as all of our tribes here, I'm sure cardiovascular disease and diabetes, again, is rampant in our population. I know everybody's focused on those two. Endocrinology, there's 26 licensed endocrinologists in the state of Oklahoma. The Muskogee Cree Nation Department of Health this past year has signed a contract, and we now employ one of 26 in the state of Oklahoma. So we have a full-time endocrinologist here that's leading our diabetes education, that's leading our diabetic program, because we know that diabetes, again, it's part of our culture, but it is preventable, it is treatable. Catch it early with exercise, good health. We're hyper-focused on our diabetic care right now. Other services that will be added here, we will have ENT surgery, we'll have full ear, nose, and throat, as well as general surgery as well at this location. So again, we're super excited for you to see this campus today. There's 50 exam rooms. When this hospital was presented to us as an oncology hospital, when we first walked through the building, we were kind of wondering, wow, some of the layout's a little bit different, but this matches up perfectly. When you think about what we do as a tribal health system, primary care is the base of what we do. So having intensive care and primary care all in one building really was nice for us. For those who have went through the building process in healthcare, usually when you build something, you think it's going to be the right size, and you're like, dang, we need about 100,000 square foot more. We wish we would have built it bigger. I'm pleased to announce that when we first walked through this building, I told Secretary Terry, I don't know how we're going to fill this place up. I don't know. We're going to have to hire 100 more staff members. I don't know how we're going to do it. We had the conversation last week. Dang, I need more exam rooms already. So we're to a point where you look at a square footage and you think, how are we going to fill this up? But again, we've got all the exam rooms, we've got all the specialists back there who've already filled our 50 exam rooms, so we're super excited about what we're doing there. We are going to show you one of the hotel rooms. Again, the unique thing about this hospital, there's 5 floors of hotel rooms, 156. We have remodeled 30 of those. Again, for our reservation, we do have our folks live somewhere between 90 to 120 miles away from this location. One thing that we want our folks to be able to do is when they need ICU care or they need a loved one with them, that they have somewhere to stay. We have remodeled somewhere between 30 to 50 rooms, and we'll show an example of those rooms, where we're going to be offering our citizens to be able to stay with their families, again, at no to little cost there for that. So we're super excited about that. Again, I talked to you a little bit about the tribal hospice that we're going to be starting. We had a very wonderful visit with the Cherokees in North Carolina. They have a great program up there. And again, kind of along the same lines we're going to do here. We're remodeling a wing of the hotel rooms where we're going to have inpatient hospice, so families can be with their loved ones and take turns staying with them as they go through that grieving and unfortunately that death process. Again, COVID really brought that to light when we had families that couldn't come to the hospital, and the only people that were around your loved ones dying were staff, right? And we want to create an environment where the infection control in the room, where you have negative air pressure, where you can be with your loved one if they're in a isolation room or need airborne precautions. We're going to be remodeling a unit up here. That way you can be with your loved ones and you can be a part of that. So we're super excited about that. Again, I kind of told you a little bit about our hospitals. Again, this marks our 3rd hospital here in our reservation. This is, again, our largest campus at this time with, again, our largest specialty footprint. So we're super excited about that. We do have 6 clinics. Again, all of our clinics offer a comprehensive primary care base, also dental vision, and specialties such as diabetes programs, as well as optometry. So we have 6 clinics. We have 1 in Eufaula, we have 1 in Coweta, we have 1 in Sapulpa, which Sapulpa is soon hopefully to be replaced with a much larger footprint. That campus is, again, we've kind of outgrown that campus. If you haven't been to our Eufaula clinic, it's a beautiful clinic. Again, I think it's nearly a city block long. It feels like it's a very big campus, beautiful campus there. And our Okemah clinic is attached to our hospital there. So again, we're very, very pleased for you guys to be here today. We're super excited. Again, as you guys go around this hospital, you'll notice on the artwork, there'll be some QR codes. I encourage you, as you guys walk through the building, if there's any artwork that really touches your heart, please get your phone out, scan that QR code. It'll go through every artist we have in here, all the way from Yautica and some of our Creek citizens. Every piece you see in here are not copies, they're commissioned pieces. They're original pieces. When we bought this hospital and we started reaching out to our people, you wouldn't imagine the warm welcome we had from our artists that says, I want to put my piece in your hospital. I want this to feel like home for one of my art pieces. And again, for our Muskogee Creek Nation legislators that have been through here, it's really emotional when you walk to this building, because truly you feel our people within this hospital. It's a beautiful piece of art as soon as you walk in the building, and they all have a story. So I encourage you, as you walk through here, scan the QR codes, and it'll explain exactly who the artist is and where they come from. But at this time, Speaker, that's all I have. I just want to give a brief overview of our health system. Again, I do want to thank our legislators. I've been here going on 10 years. Where we came from in 2013 to where we are now, we couldn't have done it without the support of you guys in the room as tribal council and legislators. So again, thank you guys so much. We're happy to give you a tour today. So any questions as far as health goes?